Hi and welcome to my channel. Today I'm going to talk about the big C, cancer. I was diagnosed with cancer back in February 2020. It was a massive shock to me and my family. Now, I'm not in the normal age category to get prostate cancer. I'm only 57 years old. I eat a plant-based diet and I'm quite fit and healthy. I do a lot of running and cycling. So this video is trying to raise awareness of prostate cancer, the symptoms, to help other people and to give you my journey in these strange times. So firstly, how is it diagnosed? For many years I've had problems with my waterworks, with restrictive flow and getting up in the night to go to the loo at least once for many years. But in December 2019 it felt like things were getting worse. It was still hard to pee, but I felt like I couldn't empty my bladder totally. It still felt like it was half full, even though I couldn't squeeze anything more out. The flow rate got even more restricted, and I was getting up maybe 3 or 4 times a night to go to the loo. Now these are all signs of potential prostate cancer. Not guaranteed, but they're indicators. So I went to the GP at the end of December 2019 and had a urine test, and then at the beginning of January I had a blood test when the surgery was back open. A week later I was called back in by the GP, which is odd because normally they give you a telephone consultation to give you the results of your blood tests. So he called me in and told me that my PSA level was 10.9. PSA is another indicator flag that there is something wrong with the prostate, potentially cancerous, which is what he told me, and he said that he would refer me to a urology specialist. The following day, on the Friday, I was rung up by the hospital. On Saturday morning at 9 o'clock I went to see the urology specialist at Croydon University Hospital. So the urology consultant told me what was going to happen next, and that I would have an MRI scan and a biopsy. I had the MRI scan on the 28th of January and the biopsy on the 6th of February. On the 12th of February I had the follow-up consultation, and that's when we were told that I had prostate cancer. The consultant said that my Gleason level was 7 based on 4 plus 3, which means that there were more aggressive cancerous cells in my prostate than there were less aggressive cells in my prostate. Of all the samples tested, 50% had come back positive. The prostate was enlarged according to the MRI. The prostate should be about 20 millimeters diameter, about the size of a walnut. Mine is about 60 millimeters diameter, so about the size of a small tangerine or satsuma. Way too big. So they then wanted to see how far the cancer had spread, if at all. So I was sent to have a bone density scan at a clinic in Wallington. So I turned up on the morning and had a low dose of radioactive material pumped into my body. I then had to wait a few hours whilst that material travelled around my body, and then I came back and had to lie still for an hour whilst they photographed my body using a special imaging equipment. That was tedious, and I needed to go for a wee during it, but there's nothing I could do about it. I will add at this point that my wife and I are followers of Jesus, and that during this whole process we had a total sense of peace that was quite unnatural. Some describe it as a peace that passes all understanding. It really didn't matter what the result was. I trusted God. If my time to leave this planet was now, so be it. However, I also felt that my wife and I still had a purpose for this life. I went back to see the consultant on the 27th of February to discuss the results and what happens next. I was informed that the cancer had not spread to my bones, which was good news. So we discussed the various options, which included hormone therapy, radiography, and chemotherapy, and also surgery. We opted for surgery to cut it all out. I was advised that I'd be off for a month after the operation. On the 12th of March, I attended a Get Set for Surgery run by St George's Hospital staff and Macmillan Cancer. This is what they call prehabilitation. It's all about getting you ready for surgery, keeping yourself fit, eating healthily, and the reason for this is that 30% of all operations in the UK have some form of complication, whether it's infections or something more serious. All the information they gave us is to help us to prevent any complications and not be in that 30%. I was quite active at this time. I was running 30 to 40 kilometres a week and cycling 20 to 30 kilometres a week as well. And I was eating healthily, as I said earlier on. I eat a plant-based diet and it's a pretty healthy diet. I had been given a date for my operation of the 4th of April. Now, by now, you will all know what's happened across the world in between those two dates. Yeah, the thing. I had a pre-operative telephone consultation on Monday the 23rd of March and then had to go in on the following Friday, the 27th of March, for some tests. That was when I discovered that my operation had been cancelled due to the coronavirus outbreak. I was unable to work from that date because of the lockdown. I did attempt to speak to somebody weekly to find out when operations would be restarting, and eventually managed to speak to the surgeon at the beginning of May, where he admitted that another hospital had been doing some operations just before COVID-19 lockdown and the patients had almost died. This was at another hospital, and because of that all operations were cancelled, and I believe that the patients were not tested for COVID-19 prior to the operation, and that the patients were in the early stages of COVID-19 at the time of the operation, which is why they had problems, and so that's why they cancelled all further operations throughout London. The consultant rang me back a week later after having had big discussions with all the other hospitals about restarting operations, and they had agreed to start, I think, the following week, and he expected my operation would take place in early June. Eventually, after 2 months, on the 27th of May, I got a telephone call from the hospital saying that my operation was on the following Wednesday, the 3rd of June. This was 2 months from my original date of the 4th of April. But before the operation could take place, I still had to jump through a couple more hoops because of COVID-19. I had to go in on Monday the 1st of June to have a COVID test and some more blood tests. On the Wednesday the 3rd of June, I went in to have my operation, and the first thing they did was do a chest x-ray to find out if I had COVID-19. I saw the anaesthetist and one of the consultant's colleagues before my operation, and they advised me that I would be going in around sort of 9:30ish a.m. Not long after that, they took me into the operating theatre, gave me an injection in my back to my spinal cord, and also gave me a general anaesthetic. Just before I had that, I could see the robot inside the theatre, and it was a bit like a very large spider with 6 legs. Because I've been very active all my life, my heart rate is quite low, and I think my resting heart rate was in the low 40s as I was sitting there waiting, or as the anaesthetic was being administered to me. And then that was me out. I woke about 4 o'clock in the afternoon feeling very groggy. I had a saline drip and a catheter attached. I was drugged up with morphine and goodness knows what other painkillers, and probably still the general anaesthetic still left over from the operation. I was given some food. I think it was a vegetable hot pot. I threw up after that. Was one of the side effects of morphine. I then slept pretty groggily for the next few hours. Eventually woke up the following morning and was persuaded to get out of bed because it was good for me. I managed to wash myself and have some breakfast and keep the food down. I went for some walks up and down the ward with help from the staff. Eventually I was told that I was being discharged that day. I was given lunch, and then in the afternoon I was given all the pads that I would need for once the catheter came out, which would be in about 7 to 10 days time. I was given some blood thinning syringes which I was shown how to administer. So for 28 days That's not pleasant. I feel a bit like a junkie injecting myself with this blood thinning agent into my stomach every night before I go to bed. And I was also given a blue pill, a low dose of Viagra, basically to encourage blood flow around the body. And that, I think, is how they discovered that Viagra worked for erections, is a side effect of basically increased blood flow. I was discharged later that afternoon from St George's, so that was Thursday the 4th of June. My wife came and collected me and took me home. I was in a lot of pain. They pumped me full of gas and my shoulders really ached. It was really, really uncomfortable. I believe that was so that they could have more room inside my body to operate on and separate the organs, so it was just easier, and they didn't disturb any other of my body organs, but it just made me really ache. It was really uncomfortable. The ride home in the car was really uncomfortable. It's not normally that bad, but South London pothole roads are pretty bad. I managed to have some food that evening and then went to bed. Now, lying down on bed was incredibly difficult and incredibly painful. It really, really hurt big time. It was so difficult to go from a sitting position, swinging your legs up onto the bed and then going to a lying down position. It was so uncomfortable. So I eventually got into that position and I didn't want to move. Thankfully, with the catheter, I didn't have to get up in the night, which was a huge relief. So the procedure I had was a robotic assisted laparoscopic radical prostatectomy. Basically, keyhole surgery to remove the prostate. I had 6 incisions in my belly, and then they were all stapled together using metal staples. I'm a restless sleeper at the best of times, and so my first night was very, very uncomfortable. I was in bed, it felt like for too long, but I couldn't move. I was in so much pain. And the only painkillers I was told to have was ibuprofen and paracetamol, because when I tried to have morphine, I just threw up every food that I was given, so I didn't take that again and just put up with the pain. On the Thursday, I discovered that my catheter was weeping around where it enters the penis, so I ended up going back to the ward at St George's Hospital for some advice, and I was actually told that basically that's normal, and so I just wore a small pad to absorb any extra urine that came out through there. It wasn't very often, it wasn't very much, but it would be enough to be embarrassing if you were out and about. Over the next few days, the pain eased, I was eating, my bowels started to move, and I also managed to start walking. I was doing sort of between 2 and 4 kilometres a day, just local walks, just very slow. My skin became itchier and itchier around the 6 incisions where the staples were. I'd taken the plasters off over the incisions after the first night, which I had been told to do, and had a shower the following morning and removed all the plasters so that the skin could heal more naturally, because it's been quite warm recently. But the itching got worse around the staples, but I put up with it because I thought it was just normal, and there were big red blotches around where the staples entered my skin. I just thought it was just a normal healing process. On Friday the 12th of June, one of the urology nurses came over to take my catheter out and to take the staples out. She took one look at my belly and said that my skin was reacting to the staples and that we'd better get them out pretty damn quick. So she did that, and then she took out the catheter. The relief was almost instantaneous, so I discovered that I was allergic to the metal staples, which I never knew. I'd never had any metal staples in my body before. As the process of removing the prostate means that they cut the urethra at the top of the bladder, remove the prostate, and then sew the urethra back onto the bladder, I've had to relearn, or I'm still relearning, bladder control, which means lots of pelvic floor exercises. The first night, and in fact subsequent nights, I've been scared of wetting the bed at night. And I've been wearing pads wearing underpants and pads during the night in case I do have any accidents. And I haven't had any big seepages or anything like that. The pads have absorbed virtually everything. But what it has meant is that I think my subconscious is making me wake up every couple of hours to go to the loo. So in some ways I'm worse off than I was before. However, the flow has been amazing. It's not something that I have experienced for as long as I can remember. And I am starting to gain control of my bladder, and I can sit for an hour or two without needing to go to the loo now after a few days, which is great, but I need to carry on doing the pelvic floor exercises and just keep on doing what I'm doing. Now, as for sex, I'm not sure when I'll be able to start having sex again. At the moment, there is nothing happening down there. But that will come back, I think, with time and possibly medication. It's quite normal. But one thing I do know, I'm not going to be able to father any more children. Yes. My 2 grown-up girls are enough. I found that I didn't have any chairs that were comfortable enough in the house. They didn't have any decent support, any decent back support. I wanted to sit up properly, and I wanted ones with arms so that it would help me get up and sit down. And so I discovered that actually one of our garden chairs worked really, really well with several cushions on, and it was very comfortable. So that's what I've been using over the last few weeks. On Monday the 15th of June, I didn't sleep well the night before. During the morning I went for a 5-kilometre walk and I overdid it. I arrived back and I was exhausted, and I collapsed. I spent the rest of the day in bed. I couldn't do much else other than that. Just lie there, not do anything. And now it is Wednesday the 17th as I record this, and I'm feeling a lot better now. Yesterday I only went for a 2.5-kilometre walk. Today I did a 3.5-kilometre walk, and it's fine. I just know I need not to overdo it. I started doing parkrun in November 2016, but I've been cycling all my life. Being this inactive, especially with the 2 months before my operation where I was cycling or running every single day, now to doing, well, for a few days I did nothing, and then now just doing 2, 3, 4k a day. It feels like it's just very frustrating, but I know I can't do anything more than that, so I just have to live with it, and I know I'll get it back eventually. I mentioned a few minutes ago that I was exhausted on the Monday and that I needed not to overdo it. Well, on that Wednesday in the evening when I went to bed, as I was getting into bed, I started getting a shaking fit, and the whole body was just shaking. It didn't last for very long, and I thought nothing of it and just thought it would just go away overnight. I woke up in the middle of the night in a pool of sweat. Next morning I got up and thought, okay, that's fine, I'm feeling okay. Went downstairs, had breakfast, was sitting down in the front room just deciding what I was going to do for the day, when I suddenly started to shake again. This time it felt a lot more serious than the night before, and so I went back upstairs and got into bed. I was shaking so violently that I had to be careful not to bite my tongue, or if I was holding my mobile phone, I was just so shaking that I would have thrown it across the room. So my wife rang the hospital, and basically they told me to readmit myself to St George's, to A&E. So that's what I did. I also had a temperature at the time. These shaking episodes they call rigors, and my temperature was about 40 degrees or over 40 degrees. And so we went to St George's, and fairly quickly I was admitted. I didn't have to wait very long, and then I didn't know how long I was going to be in for. I thought I was just going to be in for the afternoon, but I took an overnight bag just in case. When they did some tests on me, all my markers were off the scale. for my urine, which partially is to do with the operation, but there was obviously an infection there. Long and the short of it, I ended up staying 5 nights at St George's Hospital on antibiotic drip, and for the first 24 hours I was on a saline drip. They used a paracetamol drip for most of the time to try and control my temperature because it was yo-yoing. At one point in the day it would be 40 degrees, another point it would be normal, then it would go back up to 38, 39, then back down to normal. And they wouldn't let me out until my temperature had stabilised and that my blood was not showing any of the signs that it was showing before. So yeah, after 5 nights, which was a lot longer than I was expecting after the first night to be let home, but no, then they posted me on a ward. I must admit I was in the right place. I was extremely well cared for by the NHS staff. They were amazing. And they were amazing on the day of the operation as well. And very, very professional, looking after me the whole time. They even catered for my needs as I eat a plant-based diet and have been since October of last year. It was quite a traumatic time for my wife as she wasn't allowed in the hospital onto the ward, though I was able to go out and meet her off the ward, all suitably masked up. But it was really, really weird because she had to come back a couple of times to give me more bits and pieces and give me more of the medication that I'd been given before because of the blood thinning injections that I was on, and also my regular medication. So eventually I was let out of hospital. I think it was on the Tuesday before I was let home, and then I was on antibiotics for another 8 days. This time it was just tablets. That's cleared it all up, and it's now the 27th of July and I'm feeling an awful lot better. Even though I did as much as I could to stop the complications, I still did get a secondary infection, and it was a urine infection and possibly sepsis as well, which is why they took it very seriously. Even though I looked and felt fine, I knew I wasn't, and I did spend quite a lot of time resting when I was in hospital, and I was probably out of it for Thursday, Friday, Saturday, and I was just becoming a bit more normal on the Sunday and the Monday, and I was fine on the Tuesday, so they let me home. After 5 weeks I started running again, just gently, very, very slowly, and just doing a few kilometers a week. And the following week I did a little bit more, but again it's all been very slow. After week 6 the consultant rang me. There's still COVID-19 problems in the hospitals, so he gave me a ring, told me that my PSA level had gone from 10.9 down to 0.1, which is the lowest level they can detect, which was excellent news. He's very happy with the fact that I'm back exercising so soon after the operation. So the next thing to work on is the erection side of things, which is going to take a lot longer to sort out because he managed to save the left-hand side of the nerves. So the right-hand side nerves are going to take 18 months to 2 years to grow back. And in the meantime, I'm going to have to use vacuum pump and sildenafil, or more commonly known as Viagra, a couple of times a week to help what they call penile rehabilitation. So in the meantime, I'm just carrying on with life. I'm back to work now on a part-time basis. I will gradually ease my way back into full-time working. So despite all my precautions, I still managed to catch a secondary infection. It happened roughly 2 weeks after the operation, but it happened within, probably thinking back on it, within about 24 hours of the catheter coming out. There could have been something there, I don't know. But all I do know is that I was in extremely good hands at St George's Hospital, and I can't praise the staff there high enough. And the consultant and his team, they've all been excellent the whole time. So I'm really, really happy with the way I've been treated and being looked after, and the ongoing treatment is going very well. I will be tested on a regular basis. I'll have another PSA test in after 6 weeks after the last one, and the consultant is hoping that the PSA level will be undetectable, and that's what I'm praying for as well. I'm still getting quite tired in the evenings and still taking life just very gently. I started driving probably after about 5 or 6 weeks, and I am capable of doing emergency stops, which is why I've been able to get back to work. So the purpose of this video is to give you hope and an idea of what you will have to go through if you have to have your prostate removed. Now, I know my story is slightly unusual because of the COVID-19, and that most people won't have to go through that and go through the extra long wait. So I want to raise awareness of prostate cancer, that it can affect men, mainly men over 60, 65, but it does affect men under me. As I said earlier on at the beginning, I'm only 57. I'm not in the age category normally associated with prostate cancer. So if you have any of these symptoms, I would suggest you get yourself checked out as soon as possible. So a reminder of the symptoms: needing to pee more frequently, often during the night, needing to rush to the toilet, difficulty in starting to pee, which is hesitancy, straining or taking a long time while peeing, weak flow, feeling that your bladder has not emptied fully, and blood in your urine or semen. Now, the last one I did not have, but I had all the other symptoms. And along with that PSA test was an indicator that I had problems with my prostate. So get yourself checked if you have any of these symptoms. Thank you for watching, and please subscribe to my channel.